I must have, fallen on a bullet.
This is classic. Today, we're back at it with another educational react of one of your favorite all-time shows, The Simpsons. This is video number 4 to be exact, so make sure you check out the others. But you know the drill, we will be learning about and breaking down some of the crazy medical type situations and injuries of this wild and hilarious show. Before we get into it, if you're new to my channel, welcome. My name is Dr. Jordan Wagner. I'm an ER doctor. If you enjoy what you see on this channel, smash that subscribe button and turn your bell notifications on. That way you learn when I post a new video. All right, let's dive right in.
Well, I guess I don't have a choice.
Lisa, what are you doing? Oh, we're going to Dr. Nick.
Complete confidentiality? Oh, and I'm sure he's as good as Dr. Hibbert. That's so right in his ad.
And he speaks Spanish. Patients sometimes don't want to tell us stuff because they're worried that somebody's going to find out.
I must have, fallen on a bullet.
This is classic. So I work at a trauma center. We see stab wounds and people will give us the most BS stories you could hear. And we're just like, yeah, sure, okay. We know exactly what happened. And then we usually typically get the story from an officer that shows up because every bullet wound, knife wound needs to be notified to the police. I love that the intake form has all those options. It's a very sketchy place.
Excuse me, Mr. Smithers. Bart may be seriously hurt. Could we possibly go ahead of you?
No. I really would rather get this taken care of.
Oh, man.
Wheelbarrow lines over there.
Loneliness and cheeseburgers are a dangerous
Oh, give me a cheeseburger. First come, first serve is definitely not how the emergency department works. I don't know about Dr. Nick's office. Patients get so pissed off when they're not immediately seen. If somebody goes in before them, even though they showed up after them, or if they get discharged while they're still waiting. Holy cow. You have to understand, an emergency department is that. It's an emergency. So if you are waiting, you are not dying. The person that's being rushed in has a medical emergency that is life-threatening. So they need to be seen immediately. Whoa, why does Bart look so big?
Gotten a vice.
Oh, my little...
Maybe it's got a bowel obstruction or something?
Having a heart attack.
Shouldn't have a heart attack at his age. Oh, and then he just collapsed.
Come on, son. You can fight this.
Check.
Do the Bartman.
Check his pulse. Check if he's breathing. Oh, okay, he's okay.
Why don't you dance? Dance!
Oh my gosh. It never helps in a situation when somebody's screaming like that. One, the patient's not feeling well. If somebody's freaking out, the patient might think they're even worse, and then the body responds in a negative way.
Kids aren't supposed to have heart attacks. They're supposed to skin their knees and poke their eyes out and be smothered
So
by
did he have a heart
cats.
attack?
Well, Bart had a heart attack, and it's his own damn fault.
Whoa, so kids can have heart attacks, yes, but it's typically a congenital issue, but kids shouldn't have heart attacks. Now, Bart looks a little big, so I don't know if he's eating bad, his cholesterol is high, developed plaques within his coronary arteries, and the plaque ruptured, causing an occlusion of one of the blood vessels, which then leads to a heart attack.
These dark spots in his pulmonary arteries are molted milk balls.
I'll believe the milk balls for 1 second. The coronary arteries are actually the little vein-looking things on the picture of the heart that we have right now.
His liver looks healthy.
That's a wad of Laffy Taffy.
You can see foreign bodies on x-rays though, sometimes. It depends on what the foreign body is made of. If you swallow a paperclip, you swallow a nail, you swallow a penny, or a quarter, or a dime. We can see those on x-rays. It all just depends.
Now, when Bart goes home, he's going to have to follow a program of strict diet and exercise. Damn it, I will not bury another patient.
Oh my gosh. Are you serious? Bart needs to get his diet in check and some exercise. Diet is the most important when it has to do with cardiovascular disease, when it also has to do with weight loss, when it has to do with cholesterol, all of these things.
But I might explode. I'm not going to let anything happen.
Feels like
to
it's
my
going to
old
explode.
dad.
Somebody could explode, yes. You have a AAA, right? So an abdominal aortic aneurysm. What happens is that blood vessel expands, and then it could rupture due to the weakening of the wall, and then you have a ruptured AAA.
This man's kidneys have exploded. There's nothing left.
Oh, no.
That doesn't happen. What ends up happening is sometimes you can have traumatic injury to the kidney where you have blood around it, or you can have like decreased blood flow and you can have a ischemia or infarct to the kidney, or long-term chronic issues. The kidneys actually start to shrink and go away, but they just don't explode.
That's what happens when you get older. It's one of those natural things. Beautiful.
No, it's not.
Actually, his kidneys were fine.
Yeah,
yesterday.
there you go. So you got a picture of the kidneys the way that it should be, and then the one without.
Excuse me, Doctor. I think I know a little something about medicine.
Why is
Homer,
Homer?
with all due respect, this x-ray reveals a textbook kidney blowout.
Kidney blowout. Maybe from trauma, but typically not from a normal kidney the day before.
Which would explain those loud pops you heard.
I don't feel so good.
Oh, yeah, it doesn't feel good.
Oh, I'm afraid your eating days are over.
That's not funny. That's not funny. Why would you do that to a patient? So you can eat, but you just need to be able to filter out your blood to get toxins out, nutrients in and out. That's what our kidneys do.
Come on, Doc. There's got to be something I can do to help my dad.
Well, you could give him a kidney.
A kidney?
Yep. If you're compatible, you could do a kidney transplant. You can live your life with just one kidney. There's some caveats to some of these things.
Okay, fine.
The gift of life, right?
Come through for me.
Now, Homer, this may...
Oh my gosh. Put the mask up, get some gloves on, use some alcohol to wipe off that vial so it's clean. Like, come on, Simpsons.
But
Oh, he's out. He's running away because of the needle? Oh, Homer. Watch out. Oh, no. Oh, whew.
Boy, that...
Oh, man. That's messed up
He's
and
waking
funny.
up.
Oh,
Uh-oh,
I'm
what
so
happened?
glad you're all right.
Common that people get in these situations where they get scared of what's going to happen because it's a great idea, and then all of a sudden in that situation, like, holy crap, I don't want to do this, and run away. But ultimately, remember, you're giving the gift of life to somebody. If you don't, they're going to be stuck on dialysis the rest of their life, which they can survive.
Oh, great. Dad's dead.
Dad is dead. No, he's not dead.
Oh.
He's uncomfortable though.
Have you been eating that sandwich again?
Stomach, something on the stomach.
Which?
What did he eat? Company picked.
Dead to that 10-foot hoagie.
Oh my gosh, there it is.
For a week. I think the mayonnaise is starting to turn.
He's been eating it for a week. That's hilarious. At least he's taking his time, but I think it's probably going to start to go bad and spoil.
I found this behind the radiator.
Oh man, it's purple.
Suggestion noted.
Look at those shrooms growing off of it.
For a moment.
Are you going to eat it?
That's so gross.
Yes.
That's so gross. So the question is it really bad for you? Not necessarily. Cheese, molds, and things like that. Sometimes that was like penicillin back in the day. Probably will cause some GI discomfort, right? Because it's not something that your system sees normally, and it's probably going to cause abdominal discomfort, diarrhea. You might have some inflammation. You may need some antibiotics. But let's see what happens to Homer here.
Oh.
You look
Yeah.
terrible.
I don't
Yes.
care. So
Oh, look at his color. His skin.
Lips are turning blue.
Yeah, no, it's not good. So when somebody's lips are turning blue, that's due to decreased oxygenation. Usually when somebody's turning pale, green, they're sick. He definitely needs to see a medical professional and see if he's got an infection. Get blood counts, see if his kidneys are failing, see if his liver's failing, see how high his white blood cell count is just for monitoring. But please don't eat food that is spoiled.
It's shot day!
Oh, that's...
Welcome to hell.
Ah, nobody likes shot day. Kids are healthy, they go to the doctor to get their shot. So every time they see a doctor, they equate doctor with shot and they fear the person in the white coat, right? I feel bad. Like I try my best to be like happy, try to make kids laugh. It is kind of just a fact of life.
Main Avenue Medical Plaza.
Oh my gosh, look at the fear. Look at the doctor.
Fool, you live in a country where childhood diseases have been practically...
I love it. I love it. It's hilarious.
That hobo skeleton is not
It's
a
hilarious.
toy.
This is ridiculous. Only babies and ex-junkies are
There you go, Lisa.
stick me chuckles.
Do it. Oh. Okay, it's over.
Have a lollipop.
Yeah, perfect.
Well, that just leaves Bart.
Don't forget Maggie.
Oh, I got her when your heads were turned. Got her good.
Potentially want to distract them, but do it super fast. Usually the pain happens actually when the needle's out if you do it well enough, or the pain is typically from the injection of the fluid that's going in because it's dilating the space of like your muscle. I love The Simpsons. Let me know which episodes I need to react to or what scenes in the comments below. As always, make sure you subscribe if you want to see more fun videos like this one, and check out my Doctor Reaction series right here to catch up on all the reviews of your favorite TV shows. Thank you so much for watching, and stay healthy, my friends.